Hello everybody, I am Lorena from NTI and I am here with Mrs. Catherine.
Yes.
So welcome Catherine, how are you doing?
Today, very well.
Well, you came here from New York to treat your CRPS.
Yes.
How did it started?
In November, I had shoulder replacement surgery on my right shoulder, and I had a recovery for a few weeks. And in December, late December of 2024, I went to physical therapy, and it was going well until my physical therapist noticed that my right hand was swelling rather than improving. And she was familiar with some symptoms of CRPS, and she suggested I see a doctor because she thought perhaps it might be CRPS. I followed her advice. I found a doctor. The doctor confirmed that it is CRPS, and he recommended a mode of treatment that included a nerve block in my neck for every 4 to 6 weeks, plus physical therapy, and for pain, Tylenol. I asked at the time when I saw the doctor if there was any medical cure or other medication, and he said no. He explained about the disease and how it could progress and perhaps maybe deteriorate into a point where I would have less and less mobility and use of my hand. I left his office very discouraged, and I confided in friends, and they were able to help me by looking online in the internet to see other options, any place at all, other treatments. And my friend Googled about this CRPS treatment here in Italy, and she recommended I look into it. I did, along with other things that other people had found, and it turns out that this was the best option. And I contacted this office, MTI, here in Italy, and it happened very quickly. From by the time January, in my discussions with this office here in Italy, and now in March, I'm here.
Was it easy to do all this, to get the information, talk with us?
Yes.
Was it quite easy for you?
Um, the first inquiries that I made on the internet, I was put in touch with a representative of this MTI, and Sandra, and she was very informative and detailed in how to go about this process. Of course, I had to first be admitted and qualify as a patient, and she sent me many attachments in my emails to see to fill out and complete to get qualified as a candidate for this medical treatment. And so with blood tests and a bunch of things, I was able to complete the process and present them to MTI for admission. And then the doctors, professionals here informed me that, I can come.
Yes. So today is the last treatment day for you.
Yes.
So how was the week? How did you find it?
With a little early anticipation and a little bit of worry and hopefulness, I came here on Monday, began my treatment, and it went well. The staff was incredibly gentle and kind. Really, it was very, very reassuring. I expected after the first treatment to possibly have some reaction to the medication. And thankfully, I was okay.
You did very well, yes.
And the other days as well. It
Yes.
was
Did you
pretty good.
Did you find any differences between the clinic here, our system, we compare to the one you have in the States?
Well, I didn't have too much of an experience with the doctor in my home in New York. I had just the one visit. He was knowledgeable about CRPS, very busy office, and he did explain his mode of treatment. And it was very clear that is the only way that he was aware. That's it. When I was in my home, when I got diagnosed with the CRPS and was looking into this MTI treatment, I did contact my surgeon from the surgeon who performed my surgery in November. And I informed him of this development with CRPS. And I told him the doctor here in the United States recommended that mode of treatment. And also I was asking him about whether he knew of this treatment here in Italy and the drug
Neridronate, yes.
Yes. Whether he was aware of that. And he seemed to not know about the drug, and just it was a telephone call. And he also said that he would recommend that I keep on going with the doctor in New York. And I concluded that phone conversation very quickly and got the impression that he was not aware of this treatment here in Italy.
Yes, so you know that this treatment will take up to 6 months to bring its full effect, but I see that in these first days you already could experience some changes, so less pain and a easier mobility of your hand. Is it?
Yes, so far I've noticed the subtle changes, and that's encouraging because little steps are good, baby steps.
Yes.
I did expect a slow process, but even in this early stage, it is a little thing, but it's good. Yeah,
good.
It's working.
Yes, so here you could meet the rheumatologist professor, of course, the nutritionist, the physiotherapist. What do you think about them? Was it interesting to have this meeting, these sessions with them?
Well, initially I saw the doctor and he was explained the overall treatment and experience, and I went step by step with each of the professionals here, from the physical therapist and the nutritionist and did I mention?
Yes, everything. Yes, all the
Anybody?
treatment.
Anyway, and each person seemed to know their business very well, and each one seemed to be very good at personalizing the treatment
on everyone. Yes,
each one. It wasn't just a factory of one person to one patient, next person. No, the complete attention to the individual patient at the time without distractions. So it was very one-on-one.
Yes, they spent quite a long time with you, giving a lot of work, information and suggestion that you will need to take with you at home. So
yes,
some homework, as we said.
yeah, homework.
Yes, so you will need to pay attention on nutrition, go on with exercising, and anything like that.
Yes.
Okay, so do you have any suggestion for us
No, not. I don't know. It seems
to be good?
everything's okay.
Okay, so thank you very much for being here, and best wishes for your full quick recovery.
Thank you very much. I appreciate the opportunity to come here and get better.
Thank you very much.